A primary care provider is your main healthcare provider. Having a primary care provider allows you to get the care you need when you need it, with greater efficiency, less redundancy, and fewer return trips to the hospital or doctor's office. Your primary care provider's role is to provide preventative care and teach healthy lifestyle choices, identify and treat common medical conditions, assess the urgency of your medical problems, and direct you to the best place for that care.
Having a primary care provider is quite important in terms of long-term health outcomes. People do better if they have a primary care physician. Study after study has demonstrated this, and also I think it's a benefit to the patient because then they're seeing a doctor they have a relationship with, they have history with, someone who knows them well and understands a little bit about their health needs and also their social circumstances, who they are, and what their priorities are.
A primary care provider helps coordinate the care you need, including appointments with specialists. They work together as a member of your healthcare team to ensure that your unique needs are met as quickly as possible.
The primary care physician acts as a point person for the person's healthcare needs by coordinating their care. A lot of times all of the specialty notes and specialty recommendations from people's various consultants in specialty fields go to the primary care doctor where they can review them all because one specialist isn't necessarily going to talk to another, and especially if the patient has a change in their health status, the primary care physician really plays a critical role in notifying other physicians, hey, this patient has something new going on, their treatment with you needs to change or be adjusted in some way. It's actually a really important safety feature of having a primary care doctor. Everyone should have a primary care doctor that they check in with probably about once a year, depending on someone's health needs, if they're healthy and feeling well. A lot of that has to do with health maintenance and prevention of health problems.
Choosing a doctor can be challenging, but one of the greatest advantages of having a primary care physician is the bond you'll create over time. Having someone that knows your history, your wishes, and values when it comes to your health are important. To find the best primary care provider for you, you'll need to do some research.
Picking your primary care provider can seem a little daunting. You don't necessarily just want to, pick someone off the internet or pick someone off the yellow pages. A good way to start is asking friends and family for recommendations, especially friends and family that understand you and your needs and how you relate to people. Another important aspect is to find out who your insurance will cover, because that may be a limiting factor for a lot of patients. And then looking at that pool of physicians that their insurance will cover them seeing, and maybe reviewing their bios and finding out a little bit about them to see if it's someone that they think will be a good fit for them, both in terms of their scope of care and their practice style.
Primary care providers see their patients regularly, looking for symptoms a patient may not notice. Annual exams may help your primary care provider guide you toward healthy lifestyle habits that may decrease the likelihood that you'll need expensive specialty care. Research shows that people who have an ongoing relationship with a PCP have better overall health outcomes, lower death rates, and lower total costs of health care. For Ben Memorial Clinic, I'm Victoria Adelis.